My name is Jessica Weatherly. I'm dual certified with wound care and diabetic wound care, and I oversee our wound care program here at Healing Hands. Our wound care program was started over a year ago. Our focus is to ensure that our wound patients reach optimal wound healing. We have 2 wound care certified nurses on staff who each week we monitor wound bed characteristics, wound measurements, wound pictures to ensure that we're in a wound healing state. If we see a stall or a decline in those wounds, we reach out to the care team to find out if there's a reason for the decline, such as infection, and then we coordinate with those physicians for different treatment options to get the patient back into their wound healing state. Part of our goal is to stay up to date with the most evidence-based practices to ensure that our recommendations are within current guidelines. Clinical staff members, whether they're current staff or new staff, they'll go with one-on-one training with our wound care certified nurses to ensure that they understand the proper techniques for dressings, as well as the ins and outs of the dressing ordered. So to ensure that they understand what they're doing as to being able to educate the patient as to why we're using that dressing. We also teach them how to monitor for signs and symptoms of infection, how to educate the patient and their family as to what they can do to reach optimal wound healing, such as offloading, nutrition, compression if needed, glucose control, as well as seeing what the goal of the patient is. And then also what disease processes can and how it affects each wound from healing. So they each go through critical thinking skills to learn how to better control the wound environment. Also, having the wound care certified nurses monitor the wounds on a weekly basis allows us to coordinate care with the mutual patients to reach their maximum goals of healing and working with a knowledgeable multidisciplinary team so that each patient can get to the healing state. Everybody's trained to see skin assessment and when to notify the physician or the wound care nurses as to when we need to step in for a little bit better treatment. Our CNAs play a big part of that. Whenever they're showering the patient, they'll do a full skin assessment and they'll contact the RN as well as the wound care certified nurses to ensure that we get prompt treatment onto the patient. Our physical therapists also are aware of how to look for certain areas that will need wound care, and they'll be able to contact us so that we can step in and get patients taken care of a lot quicker. If you have a physician that may not be comfortable performing or ordering the wound care, our wound care nurses can go out and evaluate face-to-face with the patient and then provide the provider with recommendations as well as the why behind the recommendations for each individualized case. Wound care is not a well-taught area. It's a specialized area, so not everybody will have the focus of individualized monitoring to ensure that the patient hits a healing state. And so with the wound care program at Healing Hands, we are able to closely work with the patient and monitor those wounds on a weekly basis and ensure that they're healing versus just going out and doing dressing changes and it never actually hitting the healing state. For patient education, it includes their disease processes, medications that can affect the wound from healing, as well as how the disease will process that can affect the wound to heal. And also, if they require daily wound care, we will teach them how to perform the wound care, or if they have a caregiver that will be able to be taught, we will work with them until they're comfortable with performing that on their own. But we'll stay in the home and monitor it for infection on a weekly or couple of visits a week to ensure that they stay in that healing state and understand how to do their wound care. All of our nurses are taught how to evaluate for wounds, proper technique for treating the wounds, as well as what to look for if a wound is declining or maybe going into an infection state. And so each of our nurses will at some point during the week be dealing with wound care. It's not just a specialized team. All of our nurses go through extensive training to understand wounds. If a physician orders a eval and treat for wound care, then myself or our other certified wound care nurse will go out and do that one-on-one evaluation and report back to the physician as far as recommendations based on evidence-based practices to ensure that we're in the current guidelines. With our patients being homebound, it's not always easy, safe, or feasible for the patient to leave the home to go to multiple doctors during the week. And so having the at-home wound care program, we're able to be in there with them multiple times during the week to ensure that they understand their dressing changes, their wounds, make sure that it's getting properly taken care of. And then that way they stay at home and safe and be taken care of in their home versus trying to get out multiple times during the week. Going into the homes, we're able to see a lot of the behind the scenes of a patient's environment, as well as teaching them ways to keep the area sterile, clean, so that they don't get an infection in their wound. But also being in the home, we're able to see what their nutrition level's like. We're able to see if they have the proper food in the home, and if not, work with our resources to get them the nutrition they need for them to reach the optimal wound healing.